Hi, my name is Jennifer Lundy-Aguerre, and I'm the director at Positive Change Counseling Center. In this short video, I just want to give you a brief overview of what you can expect at your first appointment here at Positive Change. So for all of our clients, we're going to ask that you've completed consent for treatment forms prior to attending your first visit with your therapist. However, in that first visit, your clinician will go over a few of our office policies, talk about confidentiality, how important that is to the treatment process, as well as our limitations to confidentiality. And he or she can also answer any questions that you may have had from that initial paperwork. In addition to going over some of the paperwork and consent stuff, we want to spend that first session getting to know you, getting to know why it is that you're here and what you're wanting to get out of your time in therapy. Part of that process is also to start setting some treatment goals. So you can expect in the first 1 to 3 visits that you and your therapist will set some goals and how am I going to know that I'm feeling better? How am I going to know that I'm making progress in treatment? And that's by having those goals and then reviewing them and being able to track how far you are or how close you are to meeting them. If you are a parent or guardian bringing in a child for therapy and they're under the age of 12, we're going to ask that you come to that first session without your child. And the reason for this is a lot of times kids are coming into therapy because maybe there's some behavioral issues. And we find that if the parents can speak to the clinician, give the background information, here's my concerns, here's some family history, without the child sitting there listening, the parents are able to speak more freely, get the support that they may need, and also the child isn't there listening to, and this is wrong and that is wrong. That's not usually a good first meeting with a therapist. We, as therapists, want to be able to connect with your child and build that rapport and relationship. And so not having to go through the list of concerns or negative behaviors in that first session with the child present is very helpful to creating a long-term relationship between the client and the therapist. We look forward to answering any other questions you may have about what it's like at Positive Change at that first session and beyond. We look forward to meeting you soon. Thank you.